So, in order to truly help people, we need to understand um, discrimination's impact on health. It's known that because of a certain culture, right? Because someone is a certain culture or they present themselves a certain way, they are treated different. And there's different misconceptions about certain groups, thinking that one group is naturally stronger just because of the color of their skin, and so they have a higher pain tolerance. Sometimes there's a belief that people are lying for some reason when they talk about their symptoms and what they're feeling, simply because of how they present themselves. And sometimes some medical people or people part of the care team just don't want to help people simply because of the color of their skin. So there's all these different factors that go into play. So in only order to truly help an individual, we have to understand that discrimination does impact health, right? It does. There's been plenty of studies that shows that people who experience racism have increased higher levels of stress. And we also seen that because of the experience of racism, the increase of stress also impacts people's education, also impacts people's motivation to go and seek health services. So we need to understand that discrimination very much impacts health. So when dealing with this population, we cannot ignore that, right? And we need to watch out for those things. So understanding discrimination helps CHW address inequities and advocate for social justice in healthcare. Discrimination in healthcare worsens health disparities, so preventable differences, delays treatment, and increases mental and physical health burdens. So the role of a CHW in understanding and trying to reduce discrimination's impact on health is recognizing these barriers and advocating for inclusive, equitable healthcare, and also providing a safe space for clients to express their concerns, and also educating communities and challenging discriminatory policies and practices. And so there's different types of discrimination. Most people know or understand the racial discrimination, but there's also structural discrimination, there's individual discrimination, and there's also gender-based discrimination. And so when we talk about racial discrimination, it's systemic and historical barriers that prevent racial and ethnic minorities from accessing quality healthcare. And really what it is because of someone's race, they are being treated different, right? They're getting a lower quality of care, right? If there is some type of treatment available, they may not get that treatment. They may have longer wait times than other races. And the impact that this has on the individual is higher rates of chronic illness, such due to a lack of preventative care. There's also delayed or inadequate treatment due to implicit biases in the healthcare system. There also can be a form of medical mistrust, which leads to lower vaccination and screening rates. For example, during COVID, a lot of Black people didn't want to get the vaccine, and some of that brewed from the fact of they understood the history of the Tuskegee experiments, where what they did was a group of men who had syphilis. They lied and said that they were treating them. So they were shooting them up with mercury and a couple other things and lying and saying that they were treating them. In actuality, they weren't, because the whole purpose of the study was to study the progression of syphilis. And so really understand what is syphilis, what are the different symptoms and stages of syphilis until into life. And so because of that, that's ingrained a lot in the Black culture. Those who understand the history. So it nowadays, when it comes to vaccines, that often is cited as one of the reasons why people should not trust the system. There's also issues of language barriers, which creates difficulty to understanding and following medical advice, where we want to make sure that people understand what exactly is happening to them. And then how can this really be addressed by CHWs? So CHWs can promote equitable care, right? Cultural humility and trust building stages, right? So especially if you have experience dealing with different healthcare providers and different systems, you can see, oh, well, over here they did this. Why are you not doing this over here? Or when I was with this client, they did this, same symptoms, everything. Why is this client not getting that same treatment? Or I noticed that this patient over here is getting this treatment. Why is this client not getting this treatment as well? So things like that are ways that at CHW can address these inequities within the system. And also, too, we have to acknowledge the historical injustices to build trust with clients. So, for example, dealing with a Black client who doesn't want to get vaccinated because they understand the history of that. So, by acknowledging that, we can move forward and let them know, like, hey, yes, that happened, but today that is not the case. You also understand too that that has also been acknowledged by certain presidents as something that should have never happened as well. So there has been acknowledgement of that, and hopefully you can move them forward. Another thing too is to advocate for culturally competent care and diverse healthcare representation. So representation matters, right? So we want to make sure that the healthcare that is being provided, or those who are providers, are diverse and of that population. Also want to offer language support and help literacy education to empower the clients. And lastly, we need to encourage preventive screenings and healthcare engagement despite past experiences. And then we have structural discrimination in health. So these are laws, policies, and institutional practices that create systemic barriers to healthcare for marginalized populations. And one of the things about structural discrimination, it really doesn't matter who is working for the system. They have to follow the rules, laws, policies, and practices. For example, there used to be policies where student parents were not allowed to bring their children into the classroom. So, what could be a case, even if the professor was okay with a child being in the classroom, another student could complain, because that is the policy, no children allowed in the classroom. So even if the professor's okay, the professor has to follow the policy. So the professor has to say, hey, you can't bring your child in here, right? And so it doesn't matter what someone's personal um, beliefs are. They have, if they work for an institution, they have to follow the laws and policies. So similarly, if someone is a part of an institution and the rules and policies are set up in a discriminatory way, then they have to go ahead and follow the rules, laws, and policies, even though it is discriminatory and it's against what they want to do. And so, how does it impact the individual? Is it limits healthcare access due to high costs, lack of insurance, and immigration status? So, potentially, um, due to high costs, right? That's if healthcare costs too much, right? Then that means that people of low socioeconomic status, aka the people who not have a lot of money, are not be able to access the healthcare system. And typically, healthcare is tied to your employment. So if someone is unemployed, then they may not be able to get insurance in order to go to the hospital. Similarly, too, if someone's an immigrant, can't get employed, also can't afford a healthcare on their own, etc., they also may not be able to access healthcare, meaning that they can't go get services. And also, too, it impacts on health disparities, those preventable differences in underserved areas with few medical facilities. I've heard several times of um, in certain neighborhoods, there is no hospital that is close. So for some people, have to drive like 45 minutes to get to the nearest hospital, right? And so imagine if you need something that is life saving, because of the neighborhood that you lived in, there is no near of healthcare facility. This is very common for people who are in a impoverished neighborhood where they don't have access to healthcare facilities. This also could be an inadequate maternal and reproductive care facility as well. There's also might be some housing and food insecurities also involved too. And then how can this be addressed? CHWs can break the structural barriers by connecting clients to affordable care and essential resources. This is when we talk about CHWs being healthcare navigators, right? That's another term for CHWs, healthcare navigator. And this is being able to help navigate the system, really providing resources to them based on their need, and able to what we call resource mapping. So this is the neighborhood the person lives in. These are all the resources the person can access, and we provide that for them. Also, to advocate for healthcare access policies, help clients navigate healthcare enrollment, connect communities to resources, and also partner with policymakers and organizations to address systemic health inequities. Because at the end of the day, if we do not change the rules, laws, policies, and regulations, then can true change truly happen? And so that goes back when public health, we think about primordial prevention, and one of the ways to prevent things from happening and like not even giving people a chance to do it is through primordial prevention, which is changing rules, laws, regulations, and policies in order to create the cultural shift and societal shift that we are looking for. The other is individual discrimination. And so this is personal biases and prejudices from healthcare providers that negatively impact treatment and client experience. So a couple of things where just because of an individual, where however they present themselves, they could be experiencing discrimination. So it has nothing to do with race, has nothing to do with the structural issue. It has everything to do with something about that individual, right? And that's a possibility where someone's just individual and the healthcare provider just doesn't like them for some reason. So oftentimes, how this impacts is when a client is talking about their symptoms, they could be dismissed, and also they could be misdiagnosed or be untreated conditions. It lowers the quality of care for clients from minorities, LGBTQ plus, or disabled communities. Also creates like a fear of discrimination, which would result in avoiding or delaying care. So if I am worried about going to the hospital, I probably won't go to the hospital, right? Because I don't want to be treated badly. Why would I put myself in a situation? I'm already feeling bad, right? I'm sick, whatever it may be. Why would I put myself in a situation that is going to make me feel worse about myself? It also could create emotional distress and mental health issues from the negative provider interaction. So some of the ways the CHW can help address this is by navigating discriminatory experiences by fostering self-advocacy, right? Teaching a client how to advocate for themselves, also providing education and also system change. So truly what this is doing is empowering the client to advocate for themselves, right? We want clients to be self-sufficient. And in these spaces, they need to learn how to advocate for themselves. Also, too, CHWs can create safe spaces for clients to share out and to discuss their experiences. Also, to educate clients on their rights and also promote provider training, right? So we can't just look at the client. Potentially, you also need to educate the people on the care team too about about these discriminatory practices. Another one is gender-based discrimination. So these are barriers faced by women, people of the LGBTQ plus community, and non-binary individuals that limit access to equitable health care. And the impact is delayed or denied gender-affirming care for transgendered individuals. Also, too, women's pain is often dismissed, leading to misdiagnoses. Limited reproductive health care access affect pregnancy outcomes and contraceptive choices. And then also higher mental health concerns due to stigma and discrimination. So how can this be addressed? CHWs can reduce health inequities by ensuring safe, respectful, and inclusive healthcare access for all, advocating for inclusive policies, connecting clients to LGBTQ plus affirming and gender sensitive healthcare providers, educate community. Communities also support clients in navigating reproductive and gender affirming healthcare options. And when we say gender affirming, these are spaces where they accept individuals of how they are, whatever their gender is, however they want to present themselves. They don't care, right? They just want to provide care to this individual. That's their biggest concern here. Also, too, they may specialize in dealing with certain populations as well, whether it just be women, whether it be transgender individuals, etc. Right? So they specialize in that care.